Right, so experts say over 2 million kids are vaping. Thousands, unfortunately, start every day. Now the American Lung Association is working to prevent teens from becoming addicted to e-cigarettes.
Dr. Panagis Galiatsatos is a spokesperson and Johns Hopkins University pulmonologist, and he joins us live to talk about the dangers of youth vaping. Doctor, good morning. Thank you so much for being with us.
Good morning. What an honor to be here. Thank you so much.
Thanks. So a lot of parents and kids don't really understand the risks of youth vaping. So just explain how harmful this addiction can be.
No, of course. And I'll explain it in two ways, right? Because what these products are doing to the youth. So in the sense of the electronic cigarettes, there are toxins in there. There are noxious stimuli that the lungs just do not want. And up until that point, before the youth uses the product, all they've been doing is just breathing in air. So the second they go from air to these products, their lungs will be injured. And these kids will develop things from coughing to hard to control asthma. If you're a star high school athlete, you're going to suddenly find yourself struggling to keep up with your peers. And as they're seeing these kind of lung injuries, they're still turning back to the products because of such a high addictive potential. The nicotine in there and the concentration of the nicotine means these teens are going to find themselves going back and back to the product over and over again. These chemicals are really going to deprive them of their ability to achieve lung health, and over time may create a whole new generation of patients.
Yeah, you know, talking about the rates of e-cigarettes that are being used by teens, apparently they've increased 73% from 2016 to 2020, which is a lot. So what's attracting kids to this trend?
Right. So, if we compare it to the prior tobacco products of combustible cigarettes, right, we did a really good job, a good campaign of making them seem uncool, unattractive, right? There's not a teen who looks at them or smells them and says, yes, I want to do that now. But the electronic cigarettes, I mean, the product itself looks like a toy, looks like a computer chip, looks pretty cool. The smell, the aromas, the flavors that they put in it, all of it is an attractive appeal towards the teen and the youth. And from that standpoint, they want it, right? So yes, we have legislation that says you can't buy these products unless you're of a certain age, but they're still going to get their hands on it. And especially through school systems where if one peer has it, they can, pass it around and so forth. The kids who've come to my own clinic discuss getting their hands on it usually at parties. And then once they're addicted, they're going to seek it out. And when there's a will, there's a way. So there's a huge attraction to these products.
And then what are some of the signs that parents should look for if they suspect their child might be vaping?
So this is a harder part, right? Because I remember, a lot of the parents will discuss, how do I identify it? How do I smell it? Because they're thinking about traditional cigarette products. This is a whole new ball game, right? So a lot of these products, many parents will discuss when I show a slide, they're like, I've seen that before. I thought that was something for school. Oh. Or the smells kind of just throw them off because they're not noxious smells that you're usually associated with tobacco products. So what I would suggest to the parents is first things first, get ahead of the game. Go to our website by the Ad Council of the American Lung Association, talkaboutVaping.org. And that's important because it gives you insight and tips on what to take away as a parent to start the conversation. So what I'm pleading with is for parents to be proactive. Don't be reactive. Don't try to pick it up if the kids are using it. Have the conversation now, especially if you're thinking, well, my child wouldn't do it. They're being exposed every day. So go to our website to look for the key talking points and to talk to the kids, to your own kids about it. And I say this because it's going to be really hard to pick up these products at home.
Yeah, it is something you definitely see more and more. You see kids, high school age kids, middle aged kids who are out there vaping, thinking it's cool. So some great advice for parents and resources as well. So, Doctor, thank you so much for your time this morning.
It's your honor. Thank you guys so much. Take care.
Thanks.